So give us a little bit of rundown about how you got into direct primary care.
It took being an expat to do it. I moved to Panama in 2004 and immediately got involved in healthcare. I'm giving you the thumbnail version. And I brought down air and water purification equipment, set up a distributor for it, and they immediately started selling to allergists, the air purifiers. And I spent a lot of time with doctors. So with that medical connection, a friend of mine said, "Hey, can you help us out with our life flight service?" I said, "Whoa, yeah, great. I'd love to," because there is no life flight service here in Panama. There is a limited government response, but the U.S. Army used to do it for Panama before they left. And so it was through that service that I was put in touch with some former White House physicians. And they were the ones who taught me what great health care is, because they have the world's most demanding patient. And so you learn how they think, you learn how they do things, which is very, very different at that level. And the more I studied it, because I was representing them, I had to learn how to sell it. I had to learn how to explain this. And the service was for high net worth individuals and families. And it ultimately morphed into Patronus Medical, which was co-founded by my medical mentor, Dr. Robert Darling. And Rob was a terrific coach over the years. And what I learned from them, I kept thinking, God, I'd love to have this. I just can't afford it. So I looked at what are the attributes that we're really talking about. And those attributes, amongst anyone who knows direct primary care in your audience will understand the idea that the president has steps away care, very quick. He also has live-in care. So that's a little expensive for the average person. What if we did next day, maybe even same day appointments? But certainly there's phone calls. There are telemedicine devices. I mean, we can beam into the patient's location. And I started seeing some opportunity there. So I started writing it down. I sent it off to Rob. I said, "What do you think?" He goes, "Well, you're missing security, but okay, that really doesn't apply too much, but privacy does. Focal point for care does, care continuity. All these things that are familiar to DPC patients and people who are looking at DPC." And I thought, wow, I'm onto something. I mean, this could replace Obamacare, my ego check. So anyway, I go on Google and I thought of a name, and it was Primary Direct Care. Okay, cool. I go on Google, type it in, and it said, "Did you mean direct primary care?" Ugh. No, but okay. So I clicked on it. And the first article that came up that I found was on Dr. Jeff Gold in Marblehead, Massachusetts at Gold Direct Care. And I read the article, and it was spot on what I was thinking about. So while I was a little disappointed in my tardiness to the game, I was very happy that there was some affirmation for the thinking. And that's how I found direct primary care. It came from the White House Medical Unit and what they do there. What they have is primary care on steroids. I was under the impression that they had a whole bunch of specialists that were waiting for anything to happen. And I was expecting the Starship Enterprise, the latest and greatest medical devices and diagnostics. Couldn't be further from the truth. And the reason is it has to work. So they don't use bleeding edge equipment. So you learn a lot about the care, and you learn a lot about how powerful, key point, how powerful primary care is. So the president has this awesome primary care. The doctors have a Rolodex like you wouldn't believe. And so that was the roundabout route that I took. And I think it's terrific that we have this affirmation that the world's finest healthcare is provided to the President of the United States, and that the average person can get real close to it if you take out the security aspects and the assessment, being able to take the time to assess the president's health, which leave no stone unturned was Rob's favorite saying. So you take a lot of that out and the costs drop like a rock, and voila, you have direct primary care.